Let's start the session.
Hey everybody, I hope I'm audible right now.
Yeah.
Okay, so my topic is basically reversing GERD with dietary interventions, and along with that, I've also introduced some homeopathic therapeutics as well. This is the paper that I presented in Apollo last year, and it is actually a study that we did in our clinic here in our set of clinics here in Kerala, and we could see that there are a lot of the GERD incidence is gradually rising, especially in southern states. I think we can probably attribute that to the high meat consumption or whatever here. So I'll just share my slide also. Yeah, so we can get started. So basically what I've done here is that it was basically a study which was done with around a few patients here in our clinic, and I have presented it as a research work, and along with that I've also introduced some homeopathic therapeutics so that it could be beneficial for all of us. So I don't think anybody needs any introduction as to what GERD is. But still, just for the sake of it, I'd say that it is basically a condition in which the stomach acid repeatedly flows back into the esophagus and everything. This study aims to identify diet plans that would alleviate the symptoms of GERD. And how we did it was 50 children were split into into two groups. One is the experimental group and the other is the control group. And for one group we did diet plans and individualized diet plans, and the other one it was not done. And the assessment of how it was working or whether it was working or not was done through a GERD quality of life questionnaire and using the visual auditory scale. The control group was asked to follow general dietary guidelines along with individualized diet plans taking into account their medical history. So I feel like this is very critical and something that which we don't take into account as doctors when we do diet plans, and I would like to stress upon the importance of taking their medical history, because they could have some trigger factors or trigger foods that would that would make things very difficult for them. So when you're doing a diet plan, it is very important to take their medical history and so and so. And so the symptoms, the most common symptom is heartburn and a burning sensation in the chest. But other symptoms can also include regurgitation, where food or the sore liquid can come back up, and there could be difficulty swallowing, dysphagia, and chest pain in certain cases, coughing, and sore throat. And this sore throat is something that a lot of doctors do overlook, mostly because we don't take it that seriously, but it is actually a real issue when it comes to people who are suffering from GERD. And in addition to this, there are a lot of other symptoms, like for instance, there is you feel like there's a lump in your throat, or there could be tooth damage in a lot of severe cases. There could be vomiting, respiratory issues, regurgitation, chest pain, nausea, dysphagia, bad breath. Bad breath is also something that that is of a lot of significance. So these are all the symptoms. That is the overview. And I mean, all of you are doctors who are treating patients on a daily basis, and you will see that over the past 5 to 10 years, due to our lifestyle, it has actually increased. The incidence of GERD has actually increased quite a lot, and this is something that we need to work upon. Now, coming to the etiology, weak LES, lower esophageal sphincter, and its pressure is of significant importance to any doctor who is treating GERD. So someone who has a weak LES is susceptible to getting GERD more. And yeah, sorry about that. And another thing is hiatal hernia, which is often a very rare case where you will get people with hiatal hernia suffering from GERD, and certain foods and drink like fatty foods, caffeine, alcohol, etc. And that we will get into in detail later on. But the thing is that there are certain foods that can weaken your LES pressure and subsequently cause GERD for you. And smoking also reduces your lower esophageal sphincter pressure, and this is also another etiology. Lying down soon after eating, it can actually, it is something that if you look at every gastroenterology associations throughout the world, they will all suggest that you actually wait at least 3 to 4 hours after your dinner to lie down. And despite people and patients being aware of this issue, they still choose to lie down immediately after meals. And as doctors, it is very important for us to tell them the significance of not doing this. And then pregnancy, and obviously that is also one of the etiology and risk factors for GERD. Now moving on to trigger foods, if you look at that chart carefully, you will see what food is actually affecting in what symptom. So you look at something like coffee. Coffee is something that is very, very common, especially in this part of the country. And you will see that coffee actually reduces the LES pressure. It also increases the HCl secretion. And these are two things. These are two things that can actually contribute significantly to GERD in anyone, be it children, be it adults, or be it anybody else. And you look at carbonated beverages. Carbonated beverages, right now, if you look at the carbonated beverage market in India, it is growing substantially. Right now, Reliance has also entered into it. And you will find that every student after school, there is a very good possibility that they'll go and have something carbonated. And what it does is, it decreases the intra-esophageal pH, making it slightly more acidic, and it also increases the abdominothoracic pressure gradient. So these are two things which carbonated beverages contribute to the etiology of GERD. Another thing is alcohol, and more people are becoming social drinkers, and social drinkers are becoming regular drinkers. And while any criticism of alcoholism it wouldn't do justice to the harm that it does, the fact that it ticks 3 out of 5 boxes here should tell you about its intensity and what it can do to a patient. It increases LES pressure, it increases gastric acid production, and it also decreases gastric motility. And this is something very important. You will have certain foods like certain fruits which will increase the gastric motility, and that is very good for the GERD patients. But alcohol, on the other hand, what it does is it decreases the gastric motility. That the chyme that passes through the food pipe, it has to go at a certain speed, and if the speed is reduced, that also increases your chances of getting GERD. And in addition to that, acidic food and beverages. Now, like I've said, I've spoken to a lot of doctors regarding the same thing, and something that I've noticed is the fact that modern medicine doctors do tend to look down upon this theory of alkaline diet and everything. They tend to dismiss it very easily, saying that it is not relevant, it is not clinically significant or whatever. But the truth is, acidic food and beverages, and they actually are very they actually trigger a lot of issues, not just GERD, a lot of other gut disorders as well. And anyone who has been clinically treating patients for the same will understand the difference between all these. And as you can see, that it is something that decreases the intraesophageal pH. So that is also something to ponder about. As chocolate, spicy food, etc. These are all things that all doctors are aware of. And chocolate, spicy food, and dietary fat, dietary carbohydrate. And when it comes to dietary fat and dietary carbohydrate, one thing that I would like to stress upon is the fact that there are different types of fat. Like simultaneously, there are different types of carbohydrate also. So if the fat is something healthy, like what you get from almonds or avocados, it is okay. But if it is unhealthy fat, if it is trans fat or something like that, that is actually the problem here. So when we use the term of fat, you shouldn't use it as a blanket term and make sure that all fats are bad. No, it's not like that. There are trans fat which will actually decrease your gastric motility, but there are healthy fat also that will not. And there is also carbohydrate which are different, which will have different types of carbohydrate. There will be simple carbohydrate, there will be complex carbohydrate, and while simple carbohydrates with high glycemic index, they are actually bad for GERD or jowar, bajra, etc., etc. They are actually good for this thing. So I would like to stress about that point. And then high volume meals. And these are all things, these are all basic general knowledge where everyone, we've been advising patients to do this for the past many years. Not only me, all of you have been doing this, to take meals in slightly lower quantities, because people have this tendency to overeat a lot and then complain about their issues, while they can resolve all this by splitting their meals into two and having 5 or 6 meals instead of the classical you or 2 or 3. And another thing is the late onset meal, which I already told you while we spoke about the trigger factors. That late onset meal is something that which we are used to in our generation. Everybody has, they come back from work, like I close my clinic at 10 o'clock at night, and while I go take a shower, and by the time I eat, it's 10:30, and by 10:30, 11, I finish my meal, and I go to sleep, like say in like half an hour, 45 minutes, and by that time there is no gap between the meal and the time which we sleep. And in addition to that, it also what do you say, like it also creates this unhealthy cult which keeps on going for a while. So this is the result of the research that we did here. And if you would see that the control group, they had like really better relief from symptoms when it came to the compared to the experimental group. And I want you to understand one thing, is that the 25 people in the control group who were given the diet, they were all given diets that were individualized. There was no standard protocol GERD diet as such. Even though there is a standard protocol GERD diet, we had to tweak and make alterations in everybody's according to their medical history, and they got a lot of relief from from those diets. And the heartburn reduced, the heartburn after meals reduced, them waking up from sleep. This is the biggest point which all the patients told us, that once they started following the diet, the incidence, the frequency of them waking up from sleep due to GERD has reduced substantially. And another one is dysphagia and bloating, regurgitation. All these things, there was a lot of relief when they followed the diet. And any clinician would understand the fact that along with this diet, you have to give medications also, and that would actually make it that would actually improve them a lot. But the thing is that we wanted to do this we wanted to do this research to indicate the efficacy of the diet. And as much as we wanted to treat them with our homeopathic medicines, we really didn't do that with these people in the first stage, because we wanted them to get the benefit of just the diet, and we wanted to learn about it. And another thing is this intensity of regurgitation, that which we don't talk about often. Like sometimes the regurgitation could not really be that severe, and you can actually go on with whatever you're doing. But if it is like really intense, like in some cases it will become really intense. And while following a GERD diet, you can see that a lot of patients reported not feeling that much of intense regurgitation. So the different diets that you can try for GERD, one is FODMAP diet. So I think a FODMAP diet is something that you give for all patients who have gut issues. Like if you work in any hospital, you will understand that you'll immediately ask the patient to go on FODMAP diet. A FODMAP is basically you need to avoid all these stuff like fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. And polyols are basically alcohol sugars. And these are things like all these artificial sweeteners and all that, they are all polyols. And even though a lot of people assume that a FODMAP diet will make a GERD patients, from my personal clinical experience, a FODMAP diet did not help that much. Compared to an individualized diet plan, it did not. The thing is that at 4 weeks, even though although no symptoms improve subjectively both groups, no difference in response between both groups was seen without any improvement in post-intervention pH testing in both groups. So you'll see that a FODMAP diet is something, if you go, you have a patient with ulcerative colitis, you have a patient with IBS, you have a patient with celiac disease, whatever it is, whatever gut disorder it is, you can straight away, like people who don't have time, you can straight away tell them to go on a FODMAP diet. But when it comes to GERD, it wasn't that efficacious, that effective. And limited benefit from FODMAP diet and PPI refractory GERD findings, coupled with restrictive nature of this dietary pattern, do not make this a viable recommendation for patients currently, unless further testing reveals greater benefits. So they keep on saying that more and more research is needed for FODMAP diet to be indicated as something that which we can use to treat GERD as such. And I've heard a lot of doctors suggest FODMAP. When I was working in Delhi for a while in 2020-21, I remember a lot of doctors, they were actually suggesting FODMAP diet for people with GERD. But the truth is, there is absolutely no reason, there is no need for you to suggest a FODMAP diet for people with GERD. Moving on to functional foods, I feel like this is very important, and I feel like, especially as homeopaths or people as Ayush doctors, functional food is something that which we stress upon. If there are any naturopathy doctors, they will be able to explain more. Functional food refers to food that can be used for therapeutic purposes, and that has to be incorporated into our treatment, not only when dealing with GERD, but also while dealing with all sorts of food. Like, you have a patient who is recovering from an ortho injury, you can ask them to take broth, you can ask them to take sprouts, and these are all things that will accelerate the cure. These are all therapeutic dietary stuff for that particular issue. And you have say you have someone who's suffering from PCOS, you obviously give them a therapeutic diet that is known as functional food. And so there are these are some functional foods that are actually beneficial for GERD. One is aloe vera. Aloe vera, contains enzymes that can break down sugars and fat and help maintain the smooth functioning of the digestive system. So I don't know how practical it is for us to get good aloe vera here and all that. You shouldn't get processed stuff. Whatever you're taking for a therapeutic purpose, you have to take it in the natural form. And what it does is it breaks down the sugars and fat into simpler stuff, and it becomes beneficial. It helps us in the smooth functioning of the digestive system. And yogurt, when not too sour, is beneficial for acid reflux due to its probiotics. Probiotics simply means they help in this facilitation of this good gut bacteria. And another thing that I want to talk about along with yogurt is kombucha. Kombucha is it is actually, over the past 5 years, I know a lot of people who are consuming kombucha. Kombucha is also a good probiotic, and that can also be used for GERD. And while drinking kombucha, one thing that I want to stress upon is the fact that, agreed that it is a good probiotic, but you will find that there are a lot of kombucha companies in the supermarket that have added preservatives. So that kind of defeats the purpose of producing kombucha and using it for treating. So yogurt is something that you can do, and it aids in normal bowel function. Additionally, it provides protein and helps soothe the stomach discomfort, often providing a cooling sensation. So yogurt, more than it is kind of like a temporary thing. Like, you're someone suffering from GERD and you take a little bit of yogurt, it temporarily you feel really good. And low fat yogurt is particularly effective in maintaining the intestinal barrier integrity compared to non-fat yogurt when exposed to pro-inflammatory cytokines. So you go to the supermarket, there'll be most of the yogurt that they keep or they advertise will be high fat yogurt. And I feel like everyone should take care and ensure that whatever yogurt you're taking, it has to be low fat. Because in the etiology, in the first couple of slides, I spoke about how high fat stuff can actually lead to more and more inflammation. Additionally, low fat or lean protein sources like skinless poultry, fish, and tofu can help minimize symptoms. So again, it comes down to the quantity of the fat that is present in the food. The amount of fat that is present in lean protein and fish and tofu is actually very less compared to high fat food. So obviously it can minimize the symptoms. And like we have already spoken about this, high fat foods can trigger the lower esophageal sphincter and trigger acid reflux. Oats are high in fiber, which regulate digestion and reduce the risk of acid reflux. So this is, I don't know, like a lot of people actually, I do at least some 4 to 5 diets in a day, and at least around 70 to 80% of the people ask me whether they can eat oats. The thing with oats is that, agreed that it is a good complex carbohydrate, and agreed that it does help in weight loss and regulating and stuff and all that. But my point is, so when we are from a country like India, where we have stuff like millets, ragi, bajra, jowar, etc., so many options for complex carbohydrates, I don't feel there is a necessity for us to resort to something like oats. And oats is only beneficial if it is steel cuts. So if you're suggesting the patients to take oats, ask them to take muesli, rolled oats. Don't ask them to take normal oats, because that it really doesn't do much of good. Or as an alternative, you can also give them these. Nowadays, there are n number of companies that specialize in making these ragi products. Like here in Kerala, we have ragi puttu podi, etc., and we have all these palaharams which are made out of ragi or millet. And if you look at Karnataka, you have jowar, bajra, etc. So these are all high fiber, low glycemic index, complex carbohydrate. I take you back to the second slide where I told you that the quality of the carbohydrate is more important than the quantity. So in GERD, when simple carbohydrates are actually making it very difficult for the patients, complex carbohydrate will help the patient. So this is something that you have to keep in mind. And so oatmeal is often well tolerated and exert a soothing effect on the stomach lining. Bananas are considered low acidity foods and may help neutralize stomach acid. Bananas are alkaline and rich in pectin, a soluble fiber that keeps the food flowing adequately through the digestive tract, thus preventing food stasis in the stomach for prolonged periods, which help in limiting acid production and reduce the likelihood of acid reflux. So I take you back earlier when I told you about the motility. The motility of the esophagus is actually a huge problem when it comes to GERD. And the best thing to do that for that is bananas. And if you ask me which banana, I'd say the Nendran banana. The Nendran banana that we get in Kerala here is actually, it works wonderfully. And I tell all my patients with the GERD to take Nendran banana at least 1 or 2 times, because these are things that they are low acidity food. They neutralize the HCl secretion, and it also helps with this motility of the chyme through the esophagus. And these are all things that you can say to anyone, because very little people will have issues with banana. Say for example, some people who are prone to antihistamine reaction, banana is contraindicated in them. But apart from that, you can suggest bananas for everyone. Very few people they'll have issues with, like, who will have allergies and all. Obviously I tell them not to take bananas and shellfish, but this will actually, but in other people it will actually work wonders. And they say a fiber enriched diet helps to control symptoms and improves esophageal motility in patients with NERD. So NERD is basically non-erosive esophageal reflux disease. So they will have all symptoms of heartburn and everything else, but there will be no erosion of the esophagus. That is why it is known as NERD. So a fiber-rich diet helps to control symptoms and improves esophageal motility in patients with NERD. Fresh bananas effectively generate a protective coating on the esophageal mucosal lining, strengthening the mucosal defense against reflux. Almonds, a good source of healthy fats, can neutralize stomach acid and consumed as a snack or added to meals. You go to any modern medicine doctor, for every GI issues, they will prescribe zinc, because zinc will what zinc does is it provides a coat and helps the mucosal lining in the stomach. Similarly, a fiber-rich diet helps to control symptoms and improves esophageal motility in patients with NERD. So you can always suggest a fiber-rich diet, because it will also work in a similar manner. And when you look at fiber-rich diet, when you need to understand whether the patient is taking a fiber-rich diet or not. So I have this kid here called Rishit. He comes here like every once in 10 days because he has habitual constipation. he is around 5 or 6 years old, and he's been having constipation since childhood. So upon greater and deeper case taking, you will see that this kid does not eat vegetables at all. So especially in states like Kerala and West Bengal, where there is a high meat rich diet, the fiber will be very less. You look at North India, the predominantly vegetarian diet, they will have a good source of fiber in the food. But in places like Kerala, West Bengal, etc., because of the high meat diet, and because kids like say patients and kids like him, they prefer to eat only non-veg. So there is a deficiency of dietary fiber in their diet, and this is something that we need to address. This is something that the policy makers need to address, and as doctors we also need to create awareness among patients. And almonds, a good source of healthy fats. Again, taking you back to the second slide where we spoke about healthy and unhealthy fats, almonds are a good source of healthy fats, can neutralize the stomach acid and be consumed as a snack or added to meals. In addition to this, green leafy vegetables such as spinach, broccoli, kale, asparagus, and Brussels sprouts are naturally low in fat and sugar. Ginger has been traditionally used because of an anti-inflammatory property, which may help inhibit gastric production. It actually does help, and which is why we use ginger for all. I think this is common knowledge, and I don't need to explain this. Ginger is something that is used generally to alleviate symptoms of gut disorders. And the prokinetic activity of ginger has been confirmed in vitro and in vivo tests. Additionally, licorice root contains compounds that can inhibit an enzyme called H plus K plus ATPase, which is involved in acid secretion. So you need to look at the phytonutrient constituent of the food that you're suggesting. You need to look at the alkaloid composition of the food that you're suggesting for the patient. See how it affects the gut health, and then do the diet plan for them. Now it comes to enhancing digestive function. So functional food does not mean that you can only counter the issues that you're facing. You can also suggest food that will increase and enhance the digestive function. Functional foods that support healthy digestion, can indirectly alleviate GERD symptoms. Probiotics such as those found in yogurt and fermented foods promote a healthy balance of gut bacteria, thereby promoting healthy gut environment and aiding digestion. Like we already said, you can do a diet that is found in that has good probiotics in it. It could be yogurt, it could be kombucha, it could be anything for that matter. Probiotics have been offered to benefit in case of small scale intestinal bacteria overgrowth by affecting immunity and intestinal motility under different conditions. Probiotic rich foods like yogurt, kefir, sauerkraut, or kimchi may help maintain a balanced gut microbiome. So I think 2 years ago, I went to Sikkim for a bicycle expedition as the on-call doctor. And one thing that notice about the northeastern states is that they consume a lot of fermented food. And while consuming it a lot can be counterproductive, consuming fermented food in the right amount can actually elevate the symptoms of GERD. And this can improve overall digestive function and reduce the occurrence of acid reflux. Fiber rich foods like whole grains, fruits and vegetables aid in proper bowel movements and prevent constipation, which can contribute to GERD symptoms. So if you are a practicing doctor in South India, the first thing that you can do is to tell them that they need to increase the fiber, because most South Indians do not consume enough fiber. And something that I do, something that I tell all my patients, especially for weight loss and to increase fiber, this thing is that I ask them to take 3 spoons of chia seeds, soak it in 1 liter of water overnight. And the next day, take halka, like small sips throughout the day. And that actually can help a lot. It has omega-3 fatty acid. It is also a good source of fiber. And these are things that you can tell your patients if you're treating them for GERD. So this is pretty much my this is pretty much my dietary part. Now I'll move on to the homeopathic therapeutics. And homeopathic therapeutic, obviously, it comes down to the constitutional approach, and it comes down to what kind of it comes down to your individualized prescription and everything. But this is what I normally do. So if you have cough from irritating things such as salt, pepper, vinegar, wine, like alumina, you can give alumina. We normally give it in 30 or 200 potency, and with sulfur as an intercurrent remedy. Cough or heartburn from, you can give carbovec, staphysagra, and carbonium salts, all in the lower potencies, in either 200 or 30th potencies. Then GERD in post-operative complaints with bloated abdomen, Rafanus. Rafanus is a wonderful remedy. My dad introduced it to me, and I feel like Rafanus is very effective when it comes to post-operative stuff. Perverted starch digestion and rapid albuminoid digestion with intense acid acrid irritations. You can give Robinia. Robinia is something that we all use in our daily practice. We normally give 3x potency. If it is something chronic or if it is acute, we give 200. Very rarely we use ingest. And for GERD arising from rich fat food, you can give Pulsatilla, Sepia, etc. in the lower potencies. These are all common medications which everyone is aware of. Constriction in alcoholics, sulfuric acid and Naxmom. Obviously, like I've said, these are all common medicines. And in constrictions detected during endoscopy, you can give them alumina, kali, carbon, phosphorus. Stenosis of esophagus, you can give strontium carb. So in pregnancies, you can give Naxomica, capsicum, acetic acid, etc. In addition to that, generally something that I do give for my GERD patients, one is ornithogalum tincture. I know it is not indicated for GERD, but I do give them ornithogalum tincture. And in addition to that, uranium nitricum in higher potencies can also do wonders when it comes to managing GERD. So the conclusion is that the experimental group experienced a lot of relief symptomatically due to their personalized diet plans and the adherence to the diet. That how sincere and how genuinely they adhere to the diet, that is also very important. A zinc-rich, fiber-rich, alkaline diet will help alleviate the symptoms of GERD. This is pretty much my conclusion. Then I've made one diet which it was this is my generally dietary guidelines which I've given to all of them. If you want, you can note it down. This is what I gave to all GERD patients as common. Along with this, I tweaked it and I altered it based upon their personal clinical history. For breakfast, you will have ragi, millet, or bajra breakfast items. You will see that these are complex carbohydrate, high fiber, low sugar, complex carbohydrates with very low glycemic index. These will do wonders for GERD patients. And you can also have quinoa. So why quinoa is because of the fact that there will be a lot of vegetarians who come into your OPD. And when you are doing a diet for a vegetarian, obviously you have to take into account the protein deficiency. And quinoa is a pseudo cereal. It is actually a seed, but it is considered as a cereal, breakfast cereal. But it is actually a seed. It has all 9 essential amino acids. So it is a very good option for vegetarians, especially if you're doing diets for vegetarians. You can suggest quinoa along with channa and moong dal, which has to be pre-soaked. So this is one of my breakfast items. And so this, if you look at it carefully, I have made sure that they don't have to eat oats, or I try to avoid processed foods as much as I can. And you can call me whatever, but the thing is that I believe that in a country like India, we have sufficient resources to make a healthy diet for all conditions without relying on processed food and preservatives. So you'll have ragi, millet, bajra, breakfast items. These are all regional, and quinoa with channa and moong dal pre-soaked. And while doing this, one thing you should keep in mind is the fact that these are all region specific. So what I do will be something for a Kerala audience and someone for Kerala patients, and what someone say a doctor from Madhya Pradesh can do the same diet, but with incorporating foodstuffs that are more and more prevalent in Madhya Pradesh than in Kerala, which will be zinc rich, which will be high in fiber, which will have short chain fatty acids and so and so. So it is important to keep in mind that there will be regional differences and variations when it comes to doing diet plans. And the fruit cup, what I have done is Nendran banana, pineapple, cucumber, watermelon, jackfruit, along with sesame seeds. So again, you look at Nendran banana, you look at jackfruit. These are things that are regionally available. You need to make sure that it is whatever diet you're doing for the patient, they should be able to go out and buy it for themselves. There is no point in me suggesting something that is available only in Himachal and Uttarakhand, because someone who comes to me here, they won't be available. They won't be able to buy it. And you look at Nendran banana. Nendran banana has, like I said, it is something that I tell all my GERD patients to take. You tell all your patients, it will do wonders. And like I said already, 3 spoons of chia seeds in 1 liter of water soaked overnight to be drunk throughout the day. Pineapple, cucumber, watermelon, these are all alkaline foods. And that maintaining that pH in GERD, it is like a prophylactic. It is very important, and you need to constantly do it. And creating the awareness with the patient, that is also equally important. Avoid caffeine along with food. Instead, consume coconut water. Coconut water is again, like I told you, it is also alkaline. And people who consume caffeine, tea and coffee along with food, it is not very good. Like we already spoke about how the LES sphincter pressure is reduced from caffeine. It also inhibits the iron absorption if you're consuming it along with food, etc. So instead, you can consume coconut water or something like that. This is my standard breakfast for someone with GERD. Along with that, and now moving on to the right, moving on to the lunch. Obviously, like you cannot tell them to avoid rice because it is very difficult for them. So you can ask them to give brown rice or millet rice with legumes. And I think the rice that is consumed in Tamil Nadu, Karnataka, and Andhra Pradesh, it is that white rice which has a very high glycemic index. And when you eat it, you will be full, but after a short period of time, the sugar spikes go down, and you are hungry again, and you need to have meals again and again. While if you consume the brown rice or the millet rice, it has a low glycemic index. Even though most of the protein from it will not be absorbed, it is the lower sugar spikes can actually do wonders for your patients. And then drumstick, bitter gourd, snake gourd, these are all I've oysters, etc. were asked to incorporate into the diet. These are all high in zinc, especially oysters and all. You look at the recommended dietary allowance of zinc, oyster will satisfy it to a huge extent. So drumstick, bitter gourd, snake gourd, oysters, etc. they were also asked to be incorporated into the diet. And how the patient or how your patient eats the diet, that is also equally important. You cannot ask them to take it fried, or you cannot ask them to take it in a manner that will denature the vitamins and nutrients. Whatever food you are eating, you need to have it either steamed, boiled, or in that way. Because what the problem is, there is something known as bioavailability. So a raw vegetable will have, say for instance, 90% bioavailability. When you boil it, it becomes 70 to 80%. When you fry it, it becomes, say, 30 to 40%. So the method of preparation of whatever you are eating, that is equally important. So you need to convince the patient, you need to create awareness among the patients about this also. Another thing this salad is something that I tell all my patients to take. Cucumber, yellow bell pepper, onions, carrot, sesame, and pumpkin seeds with ginger, turmeric dressing. 2 spoons of apple cider vinegar, 1 spoon olive oil, turmeric, and ginger. You look at this, there is yellow bell pepper, which already satisfies your recommended dietary allowance for vitamin C. And then there is also cucumber, which increases the fiber, and there is also apple cider vinegar, which is alkaline. So what it does is, like I said, rather than asking them to eat a lot of food for lunch, ask them to split it into half, and for the other half, ask them to eat the salad. And it will help not only in GERD, it will also help in them also getting all their micro and macro nutrients in a day. And for dinner, again ragi and millet roti with chicken, fish, tofu curry with minimal spices. Like we've already spoken about how spicy food can trigger GERD, so very minimal spices. salad, which is the same as afternoon, and fruit cup, which is same as breakfast, and a little bit of buttermilk with ginger in it. So this is pretty much my standard GERD diet, and like I've said around 5 to 6 times already, make sure that before you give this diet to the patient, make sure that you tweak it according to their individual medical history. Okay, so that is pretty much my presentation. So if you have any doubts or queries, I'll be more than happy to deal with it.
Thank you, Doctor. So you point out the importance of not sticking to FODMAP diets and to prescribe or find out some functional diets, specifying or just noting what thing a person will be beneficial is while selecting a diet. These are all sure it will be beneficial for all persons and patients. And I think a lot of persons will be here to interact with you. And it's the time to interact with the speaker. You can hand raise. You can raise your hands and that I can invite you. Dr. Amal, I need to ask another thing because we are living in a very fast life. We are. You also mentioned that there is less time for us to metabolize our late night foods, and we are very fast. We are not getting enough time to digest our food, which we are eating in the night. It's very right, and it's all a high calorie, predominantly calorie, highly nutritious diets, having very less fiber. These are all affecting these days. And other thing is lack of exercise and a very stressful life. These are all affecting or aggravating this GERD, isn't it?
Sir, I'm not able to hear.
Sorry? Am I audible now?
Yes, sir. Tell me.
I think in this fast life,
correct.
We are not getting enough time to do exercise. We are in a very stressful life. This itself is aggravating the Gastro-Oesophagal Reflux disease. And what about you? We are not mentioning much about the exercise part, relaxation part, and what homeopathic medicines is focusing on these things. The constitutional aspects, the generals, which we need to, the pointers, which we are going to individualize these persons, the character, everything we are considering, well.
Correct, sir.
So that also we need to consider, I think.
Yes, sir. Sir, basically this was just a GERD therapeutical diet PPT that I submitted there, and for the sake of this, this session I've just incorporated a little bit of homeopathic therapeutics.
Excellent.
So there might be some issues, but this was mostly just a therapeutic dietary stuff for GERD, and it was less about homeopathy when I presented it over there. But now for the session, because I was aware a lot of you would be joining, I have incorporated a little bit of homeopathy also into it. So there might be some issues with that. Sorry, sir.
It's nothing. It's great. And I was just mentioning about these things also. So if anyone need to speak, they can add more. We can interact with the speaker. I think there is a message from Swasti Upadhyaya. Quinoa, though being a
Swasti quinoa, though being a pseudo cereal, in a cup it hardly gives 8 grams of protein. Is it really a good source of protein? And for lunch, what protein source can we give? Sir, stressing on protein because it's very important for children's growth, as we know. So Swasti, yes, that is true. Even though it is a pseudo cereal, the protein amount would be very less. So you can either ask them to consume legumes or pulses if they are vegetarian, or normally I tell them here to eat fish curry because most of my patients here will be non-vegetarian, but for vegetarian you can ask them to consume legumes and pulses also. And the method of preparation, that is also very important, as we have already said. So that is actually a very good point. Even though it is a pseudocereal, it gives very less amount of protein, but I just wanted to clear that, like, say, for especially a lot of clinicians, they become confused as to what happens when a vegetarian patient comes into you and you need to meet their requirements. So that is why I just suggested quinoa. But what you've said is very correct. You can ask them to eat pulses or legumes for their source of protein.
Okay, let's welcome Dr. Dhanish. Sir, please ask.
Thank you, Dr. Vindirex. And excellent presentation, Dr. Amal Chandra. You really rocked the floor with your knowledge and your experience in managing such cases. Really,
Thank you, sir. Thank you, sir.
Yes. Usually we used to find the right remedy and then we used to give medicine. And sometimes a patient may get benefit from the very first dose itself. But thereafter we may find that there are certain things that really does not work for the patient. And so in those conditions, when we look into that, we find that the food is the specific reason behind the food is standing as an obstacle in the way of cure. So this kind of knowledge you shared in this platform is really worthwhile, worth for all of us.
Thank you, sir. Thank you so much.
And the right food and regimen can really excel cure in a short time. That's what we have experienced. Unfortunately, people believe that we will have to eat more to work more, and but usually people take a lot of food even night during night, because then that is the time they get a family get together and they used to sit together and eat together and talk together. So usually a lot of food being taken at the time, and that really makes a big problem. So we need to educate people in such a way that what kind of food do you have to take and what is the time, what is the better time to take food, and how much of food is required in the morning, how much is required in the noon, and how much required in the night. Now, nowadays, what people used to do is that they simply eat for eating. That is the problem. They simply eat for eating.
Correct.
What's your opinion on that?
Sir, eating late. You're talking about eating late and eating processed food.
Eating like late and eating for eating.
Sorry, sir. Hello.
People used to eat a lot of things for the satisfaction of eating.
Okay.
But really, it's not a healthy side.
Correct. Correct.
Yes.
And so something that we need to deal with when it comes to eating disorders, like what you said, is that most of the people who I feel like I've seen people here from the info park, especially all these techies and people who lead a sedentary lives. You need to identify whether it is an eating disorder or not. So if it is an eating disorder, they are not eating because they're hungry. They're eating because there is a compulsive need for them to eat. And in that cases, we can address that from a homeopathic perspective. But in other this thing, if they feel the need to eat a lot, you can tell them to eat salads. And they have this thing where they need to eat as until and unless the food is like completely fill the stomach, tell them to take salads or tell them to consume fruits like watermelon, which will have high water content. So in that way, they are also satisfied because the stomach is full, and but the calories will also be very less. But then again, all these things, it is easier said than done. It is very easy for us to say, don't do this, don't overeat or whatever. But the truth is, when it comes to the practical application, the patient will require medications. The patient will require medications to control their cravings. And I feel like as homeopaths, we can do that easily. You have medicines for all sorts of cravings. Put them on medications. Tell them that it is something that will increase their metabolic rate or whatever, and put them on medications, and then do the diet for them. Because doing the diet and telling them to reduce the consumption, that is only half done. For them to practically implement it, they need to ensure that the cravings are also met. So that is actually a very important thing that you said, sir. It is something that we deal with on a daily basis when it comes to the actual practical application of the diet.
Thank you, Doctor. Exactly what.
Thank you. And the very curious thing is, though Kerala is very rich in leafy green surroundings, we are less eating leafy
Yes.
vegetables.
Yes.
Regionally in Kerala, you mentioned that in South India, persons are consuming less, very low, they are taking less leafy vegetables and
Correct.
diet also.
Correct. And this not only it is also leading to GERD. This lack of vegetable consumption is also the reason why we have become the diabetes capital of India. You look at two highest instances of metabolic syndrome in India. You will see Kerala and West Bengal. These are the high meat consuming states. So even I around 4 to 5 years I was in North India, Uttarakhand, Uttar Pradesh, etc. And I saw that they eat more sweets than us. But why is it that they are not diabetic? Because you look at a high vegetarian diet will have the phytonutrients in it to reduce the blood sugars. But here, even though we don't eat that much sugars, we are increasingly becoming diabetic because of the high meat diet. Those people, they eat sweets, but they also eat the vegetables, and that keeps that blood sugar in check. And this is something that we need to create awareness among the people.
And also these melons is also more towards alkaline thing, and it's also acidic, but it's towards alkaline, I think. Isn't it?
Correct.
So it was a nice session. I think it's time to conclude, and few more minutes. If someone need to interact, they can.
Sir, I think there is one question. Most people suffer from low stomach acid. How would you tell the difference? What would your cure be? If a client has insulin resistance, banana would be a high carb food. How would you treat someone who has insulin resistance and GERD, low stomach acid? Most people suffer from low stomach acid. I'm not sure. I think it is you need to diagnose it properly. You need to, like, a lot of people will tell them that will come and tell you that they have low stomach acid. It is often self-diagnosed. They need to go to a doctor properly. What the problem with treating people with low stomach acid is the fact that if you have low stomach acid, then the absorption and assimilation will not take place. So you will have to put them on multivitamins. And when there is no other option, you have to do that. And what would your cure be? So I think my cure would be, first I'll treat them. We do have medications in homeopathy to increase the production of stomach acid. First put them on medicines, and only if that doesn't work, you put them on multivitamins. And if a client has insulin resistance, banana would be a high carb food. Yeah, obviously. How would you treat someone who has insulin resistance and GERD? So basically, like I've said, I told you, like when I showed you that diet, I told you that you have to take into account the patient's specific medical history and alter it accordingly. You don't have to give someone with insulin resistance banana, because that would be counterproductive. You can give them other stuff. You can give them the other stuff that I've mentioned in the slide. Banana, I said that because from my clinical experience, I've given it to people, obviously people without insulin resistance only. It has seemed to be very effective. That is the only reason why I suggested banana. If it is a patient with someone who has insulin resistance, don't give banana. But there are plenty of other options. You can give them therapeutically. Will you please show the first two slides? I'm trying to, but I'm not. Wait. Sure. Which slide do you want? First two slides. So this one or this? I think it would be easier if you just text in that number. I'll share the entire PPT with you. I have no issues in sharing with anyone. I've just texted my number in the chat window. If you just message me on that, I will share the entire PPT with you. Okay?
Yeah, sure. That will be good.
Okay.
And I think it's the time to conclude.
Okay, okay, sir.
Any more thing to add? Okay. It's a great and excellent session. On behalf of Ifph, I thank Dr. Amal Chandra. And please be here again with more insights, more informative sessions. Thanks, and over to Malayalam.